Hello, I'm Dr. Warren, and as part of Lyme Awareness Month, I wanted to go through just a common mistake that I see when I have patients come to me who have done Lyme programs. See, I have some patients who come to me and don't know that they have Lyme, and they've discovering and running through testing and trying to figure out if the problem they're having comes from Lyme or a tick-borne illness. I also have a good amount of people who come to me knowing that Lyme and other tick-borne illnesses are part of their problem or a big part of their problem. And they've maybe tried some different protocols, either on their own or with other doctors, and they've been unsuccessful. And here I want to run through really one of the top reasons I find if you've tried a Lyme protocol and it didn't work, why it didn't work, and one of the big failures I see. All right, so here we go. I just want to note that I'm not often the first doctor that someone has seen when we're dealing with Lyme. We usually go to their primary, and oftentimes people will be sent follow-ups, so they'll be sent to neurology or rheumatology. And about a quarter of the people we've seen at any given time have been in Minnesota hard cases, usually eventually either get referred on to the University of Minnesota or over to Mayo Clinic. And I'm recording this in spring of 2023. Still, we really don't have either Mayo or University of Minnesota who have taken up Lyme and really attacked it and tackled it. They still do just very, very minimal conventional, kind of the accepted stuff from the early 90s. You've got stuff pushing forward with Columbia, stuff with Johns Hopkins and some other big research institutions pushing this forward, but we really don't have a center for the Midwest. So still, things here are still they have to be very basic for them to really go after tick-borne illness. So I'm often seeing, multiple doctor records before someone comes to me and realizes chronic Lyme or post-treatment Lyme is really in the picture. I have this picture of, early airplanes, and I think the Wright brothers, if you ever read their story, is really just a great example of, humans, persevering to accomplish something. And I think that's rare. And I think that's what really has to be done in order to help people heal from Lyme, because there's going to be some bumps along the way. And being able to problem solve when you try something and it doesn't work, the big issue that I run into is I think the only failure is when you do something and then you fail to learn from it. If you learn, you can get a step closer to succeeding next time. Then you try again, and you try again, and you try again. And I tell people, if you can keep learning, you're going to get there. You're going to accomplish it. Now, we want to learn from other people. And if we can, find a way through, we don't have to make every mistake in the book. But this is really what happens. If people try something, they don't really know what it means, and they can't navigate the ups and downs, and then they just kind of give up. And this is really what I think, my job is as a doctor, is to figure out, okay, why didn't the protocol work? Why did it work? What parts of it worked? And if I can help you troubleshoot and kind of punch through those obstacles, then we can be successful in helping you be healthy again. If you tried a protocol and it didn't work, then my big question is, well, why didn't it work? Right now, this is a slide that we bring up, and I like this slide, don't like this slide. I tend to use more picture-based slides than this, but I will walk through it even though it's a lot of words. When we have chronic Lyme, the idea that you're just going to take an antibiotic for a really short period of time and then you'd be magically cured just does not really happen, right? We know the antibiotics work well right away when you first get it. It's a simpler disease. Once you've had it 2-3 months or more, and many people who I talk to have had it for a year or sometimes even a decade or more, then these kinds of real simple strategies just aren't reality for the vast majority of people. So when you're dealing with chronic or post-treatment, what happens is we want to go through these 4 stages. And I'll just show the colored arrows, what I want to hone in on. I know there's lots of words, but just hone in on these. So we have to do something to help kill the chronic Lyme and co-infections. That's that orange arrow. And then we're going to have to do something to help our immune system. That's that blue arrow. And then the next 2 is about rebuilding the body. So you're going to need raw materials, and that's our green arrow. And that involves nutrients and raw materials and healthy hormones that help our body function. And then that last part is going to be exercise, both physical and neurological, because you get out of shape and get deconditioned and you're not strong and vital after you've been sick for a while. So this is really the approach we take. And then you'll see under each arrow, I kind of break down certain things that happen. Now, when I have someone who comes into the office, what I'm going to do is I'm going to look through and go, okay, did we figure out what was wrong? And then if you tried something, it's the biggest problem I see is there's not enough retesting. There's not enough retesting because it's hard to go only based on symptoms. We want to go based on tests improving and on symptoms. I cannot show this enough. This is the biggest mistake that I see. The analogy we use for this is if you step on 3 tacks, the problem with just following symptoms is if I take 1 tack out of your foot, I can't then look at you and go like, well, does your foot feel 33% better? It doesn't. It's hard to track. And also, if I pull out all 3 tacks, we go, oh, does your foot feel better? It'd be like, well, I still have bleeding holes in my foot. So this is what's really hard is you can make progress. And I find this all the time. I find people who are very discouraged because they don't understand that it's not just a 1 tack problem, it's 3. And not only do you have to pull the tacks out, you also have to heal after the tacks are out. And that's where those first 2 boxes that we talk about are that orange arrow and that blue arrow is really that immune response and fighting the bugs. That's like pulling those tacks out of your foot. But the green arrow and the yellow arrow, which is just rebuilding the body, a lot of times has to do with healing afterwards. And you really need both things to happen so that your foot feels good and you can run on it and you can jump and you can walk and you can do all these things. So understanding the problem is just a little more complex than that, that super simple view really can help. Okay, did I make progress? Because this is what's actually, to me, most motivating is I find most people made progress. If you worked with a doctor or you did something, I go, okay, you solved part of the problem, but you didn't solve all of the problem. And that's why you didn't really get better the way you were hoping. And I'll just show a couple of examples. So I just took from some patients that we've been working with that I have, they came in, they'd done another protocol, and this is why a certain person might have failed. So they didn't kill Lyme. Even though they tried to kill Lyme, they really didn't kill the Lyme. And this person didn't kill it because they're lacking simple immune nutrients. And we know from the Columbia research team that the antibiotics or even the herbal antibiotics, anything you're doing to kill it does not 100% finish off the bug. You need your immune system to finish up or mop up and finish the job, or I say he has to run the last leg of the relay race. I was a track and field guy, is always run by your immune system. So if you're missing simple nutrients like vitamin A or vitamin C or zinc or some other nutrient that's necessary for your immune system, then you can't finish the job and the whole system breaks down. Now, also this person had a lot of joint pain. Not only do you have to get rid of the Lyme, but you have to then heal the joints after the Lyme is gone. So you might need collagen and you might need manganese and you might need to exercise all the muscles around the joints again so that all the joints can function even after you get rid of the Lyme. Okay, so that's this particular person. So this is another person who came to me, and this time we still have to kill Lyme. Lyme was the big deal, but it really wasn't a nutrient problem. It was a biofilm problem. In their past protocol, they hadn't done anything that really gets through biofilms. Biofilm is one of the main ways that Lyme protects itself so that your immune system can't get to it, and so other things can't get to it. And if we don't break down that biofilm, then a protocol can fail. And so these are 2 people who both had not worked to kill Lyme, but one was really a biofilm issue and one was much more of a nutrient issue. And so the strategies that we used in each case were very different as I looked through the details of each case. Now, this particular person didn't have as much joint pain as much as they had nerve pain, burning and tingling and neuropathy and a lot of nerve symptoms. And so once you're done killing the bug, it wasn't necessarily about rehabbing joints and muscles as much as it was about nerves. And particularly hormones, we find, are a huge part of almost all rehab. You do need the proper hormones to rebuild muscle. You also need proper hormones to rebuild nerves. For men, that's mainly testosterone is so important for all the nerve symptoms in men, and estrogen, progesterone, extremely important for women rebuilding nerves and really healing nerves that have been irritated or damaged from these infections. And again, I want to highlight that you could kill the Lyme, but if you still have the nerve damage or the joint damage, you still have a lot of the symptoms that you came in with. And not retesting can make you get lost and not realize the progress that you are making. This is my last example we'll do today. Is this person actually thought they were in a Lyme fight and they actually got rid of the Lyme, but still had a co-infection. So Babesia, Bartonella, Anaplasma, Powassan virus are your super common, your top 4 co-infections. And if you don't get rid of those, you can still have a lot of symptoms. Now, this particular person also had a lot of problems with herxing, meaning every time they tried to do a killing protocol, it really had a lot of side effects. We know this can happen for some people. As you kill the bugs, the immune system sees the dead bugs and creates more inflammation. As the immune system reacts to the bugs dying, your symptoms get worse as that inflammation comes up, which is extremely unpleasant and hard on you, hard on someone who's already sick. So this person also, we just had crazy fatigue. So they had what I call push crash fatigue. Every time we try to do something, you tank. Every time you push and try to do something, you kind of pay for it, and then you kind of crash. So this was a lot of mitochondria nutrients. I remember this one, CoQ10, was super important for helping them get just energy back. Super important for brain function as well, memory, those kind of things. So, and then after we got rid of it, we had to really slowly work back up the physical activity because they'd spent years being very minimally active. We put a step counter on this person. They were at like 500 to 1,000 most days. We really want people to be up. 10,000 is a good active step count to get up to. But it took us a while to just work our way back up to being, physically active and have good stamina. And so this is just still an example of, even when we got rid of the co-infections, they still were not in good shape. And it took us 6 months after we thought they were clear of everything to rebuild the stamina to a reasonable level. Tracking through the problem is so important because you can make progress but not feel it with your symptoms, and that's kind of the key. Is the biggest problem I see is just not retesting, because people don't see the progress that they should be excited about, because you may not feel better. Some people feel better early, and it's wonderful, but many people, you're not going to feel better until you start to get that body repair, that things start functioning. Only going off symptoms by themselves can really trip you up. And I'll do the tax syndrome again, but once again, the cure for 3 tax syndrome is not just take Advil while you keep the tax in, right? And if you pull 1 tac out, that's a progress. You should be encouraged, but you probably won't feel better because you're not going to pull 1 tac out and feel 33% better most of the time. And then even after you get all of it out, you still have to heal and recover. And watching yourself do that process can be encouraging, because the symptoms usually come better as you fix enough things that where your body functions better, right? So retesting is just urgently needed in order to track your progress and figure out what part of the program is working, and then what part of the program is maybe not working that you need to adjust so you can be successful. So, we want to personalize what we're doing based on your responses. And once again, the biggest mistake I see is people come in with tests, they have a protocol, it doesn't work, and they never relook at anything, they never retest anything. And I'm going, well, what part of this worked and what part failed? And I don't know unless you relook at some of these tests and go, did this improve, yes or no? Because what you're going to find is you probably fixed something if you tried, but you probably didn't fix all of it. And that's why you don't feel better. But I need to know which parts worked of your program and which parts did not work, so we can readjust those parts that didn't work so you can be successful. I'm Dr. Warren. Hope you found this helpful.